Hello, this is Dr. Kim Jeong-gul. Today I will lecture discrepancy. Discrepancy can be divided into two categories. One is the anterior discrepancy, which is discrepancy of the teeth in front of the first molar. And the other is the posterior discrepancy, which is discrepancy of the teeth behind of the first molar. In orthodontic treatment, the part that was mainly observed, evaluated, and treated was anterior discrepancy. In other words, these are crowding of the anterior part, protrusion, cross bite of anterior teeth, deep bite, midline deviation, open bite, and so on. However, in order to evaluate anterior discrepancy, you also need to evaluate posterior discrepancy. Posterior discrepancy is the discrepancy of the posterior part of the first molar. For example, there is a difference of position of the third molar or impacted of third molar. Mammals that walk on all fours develop anterior mandibular growth as they grow. However, human grows vertically while the forward growth is limited. In other words, as the anterior growth is limited, the posterior growth occurs more, and the posterior teeth erupt in the order of first, second, and third molar. Typically, anterior growth occurs followed by posterior growth. Professor Sato said that if posterior growth does not occur enough, problems can arise. In other words, if posterior discrepancy occurs, it can lead to over-eruption of the posterior teeth and can lead to mesial angulation. At this time, the standard is the distance from the mesial cusp of the first molar to the PNS for the maxilla, and the distance from the first molar to the ramus anterior border for the mandible. Posterior discrepancy can observe of extrusion and mesial angulation of the posterior teeth when viewed from the lateral view, and mesial rotation of the posterior teeth when viewed from the occlusal view, and the curve of spee or lingual torque of posterior teeth when viewed from the frontal view. In some cases, we can also observe a scissor bite in the posterior teeth. Once again, posterior discrepancy can lead to extrusion and mesial angulation of the maxillary molars, or it can cause mesial rotation and scissor bite. If posterior discrepancy occurs in the mandible as well, it may cause extrusion, mesial angulation, and lingual torque of the mandibular molars. In this patient, anterior crowding is observed. Tooth 37 is impacted, so we can see mesial angulation of teeth 30. Therefore, the anterior part may also be affected by posterior discrepancy. The picture is an example of teeth with mesial angulation and teeth that are upright. During the daily chewing process, we apply some force to the teeth, and the teeth are forced to become mesial inclination. This is what we call the anterior component of force. In other words, the anterior component of force is that the tooth tends to angulation into the mesial throughout its lifetime. In addition, the anterior component of force can be affected by various factors, such as tooth shape and angulation, occlusal force, muscular force, and transeptal fiber. Among them, it is greatly affected by the mesiodistal angulation of the tooth and the occlusal plane. The following cases are Class 2 low angle and Class 2 high angle. In Class 2 low angle, the mandibular plane angle is relatively flat, and the mandibular posterior teeth are upright. In Class 2 high angle, the mandibular posterior teeth are mesial angulation, and the mandibular anterior teeth are also affected. Previously, the intermolar angle or interincisal angle was mainly evaluated before the occlusal plane was evaluated. But now, the occlusal plane of the posterior teeth is mainly evaluated. This is because if a patient who has already severe mesial angulation has posterior discrepancy, mesial angulation may be worsened by the anterior component of force. This patient is 58-year-old, and he came to the hospital as chief complained that the crowding of the mandibular incisors was getting worse, and the protrusion of the maxillary incisors was getting worse. Will this patient get worse and worse in the future, or will it remain as it is? These symptoms will get worse as the periodontal is poor and the posterior teeth become more and more angulation. If there is a premature loss of deciduous tooth, the first molar of the mandible can be mesial angulation. And if the patient is a patient with posterior discrepancy, the medial migration of the first molar will tend to be pathologic rather than physiologic. This means that the mesial angulation of the first molar is heavily influenced by the presence of posterior discrepancy. The occlusion can be further migrated to the mesial by the transeptal tissue, when there is a mesial angulation of the posterior teeth. Also, as in the picture on the right, the lower posterior teeth are angulated, mesial, and the maxillary posterior teeth are also angulated mesial, showing a class 1 relationship. However, teeth that are angulated like this can sometimes cause other problems. In this model, the left molar teeth of the mandible are mesial angulation, and the molar teeth of the maxilla are mesial angulation, showing a class 1 relationship, but canine is a full class 2 relationship. It is possible that the tooth 33 of the mandible has been moved posteriorly or the mandible has been moved posteriorly. This patient was a case of extracting the first premolar of the maxilla and the second premolar of the mandible. After treatment, good occlusion is shown. When the patient visited the hospital 3 years later, the mesial angulation of the detention was intensified. In the process of extraction orthodontic treatment, the posterior teeth tend to become mesial angulation, which can lead to continuous angulation of the teeth unless they are upright and finished at the end of the period. The teeth on the right are like that. In conclusion, anterior discrepancy will be affected by posterior discrepancy. And posterior discrepancy is important to check for discrepancy of eruption state of the first, second and third molar. Thank you for watching.